Okay, so my patient is a 20-year-old collegiate basketball athlete who has sustained a second-degree hamstring strain. He is 2 weeks into his rehabilitation process, so he has finished the first phase of his rehab, which the goals of that phase were to reduce his pain and reduce his swelling, so reduce inflammation, and also allow time for the fibrin plug of his wound to gain more tensile strength. So, because we finished those particular parameters, we're allowed to move on to the next phase, which is the active phase. This is phase 2. In this phase, our goals are to increase range of motion, increase flexibility, maintain the parameters that we already restored in the first phase, and also to move on to easy isometric exercises or active range of motion exercises, such as four-way hip or strengthening exercises that the patient is able to do without too much pain, or without pain at all, actually. So our first exercise that is appropriate for this phase is going to be a hamstring stretch, a static stretch. We have a couple of modifications in case the patient doesn't feel comfortable with one of them. And then we have a progression to an actual static stretch that they can apply on their own or that someone can apply to them. So the first modification is going to be with the patient laying supine on the floor. His uninvolved leg, which is the left leg, is going to be straight on the ground, so fully extended at the hip and the knee. His involved leg is going to be at 90 degrees of hip flexion, where the patient is going to take his both arms, grab the posterior side of his thigh, which is the back part of his thigh, pull up his leg into 90 degrees of flexion at the hip and the knee, and then we're going to instruct the patient to slowly extend his knee. I mean slowly because we don't want the patient to pull his knee too far into extension to where he starts to feel pain. The farther you pull your leg into extension, the more you're going to feel the stretch, and we want him to just feel a stretch and not pain. Here we want to watch out for any substitutions, such as maybe an arching of the back or maybe a posterior or anterior tilt of the pelvis. To avoid those, you can put your leg back down. To avoid those situations, we want to make sure that the patient has already completed his pelvic tilt exercise, which is will allow him to figure out the mean or the mid-range of anterior tilt to posterior tilt and find his neutral. And then just the arching of the back, just make sure you tell him some cue things to make sure he is not substituting. A modification could be with the chair. If the patient did not like the stretch on the ground, a modification can be the patient standing up. If you have a chair at the house, because these are home exercises that you should be able to do at the house, you can have the patient stand in front of the chair, elevate his leg, the involved leg, so stand on the leg that is not involved. Elevate the leg, back up just a little bit. He's in hip flexion right now, and then he's in knee, hip flexion and knee flexion. So the way we're gonna feel the stretch is he's on his heel. We're gonna have him slowly extend the knee. Extend the knee here. So he's gonna slowly extend, move forward, and then slowly come back. Extend. So move here, move back here. He's gonna slowly extend by moving backwards. And then to enhance the exercise, we can have him invert and evert his ankle and lean forward. So hip flexion. And then he'll feel a stretch in the hamstring as well. Both of these exercises can be done in sets of 3 or 4 for 30 seconds, and you can do it 3 or 4 times out of the day to enhance his flexibility in his hamstring and range of motion. Perfect. If that is too easy for the patient, and the patient already has that amount of flexibility, the patient can also sit on the ground facing the wall, and we can do a static stretch. So a static stretch can either be applied to the patient, but if the patient doesn't have anyone to apply it, then he can do it himself. So you just need either a wall or a stretch band. If you don't have a stretch band, use a wall. So basically what the patient is going to do is he's going to sit as close as he can to the wall, and then he's going to have the uninvolved leg flexed, and then he's going to lift his involved leg up on the wall and let it just sit in the extended position. And if he needs to get closer to the wall, he can get closer to feel a better stretch. If he can't get closer to the wall, and this is all that he is able to stretch, then he can do 30 seconds there for 3 sets as well. And then if he needs something else, then he can use a stretch band or have someone apply it to him. Same thing, we want to make sure that his hips and his back are straight and that he's not compensating in any other way. So the second exercise for this phase is going to be a strengthening exercise. My patient is going to lay prone, so he's going to lay on his stomach. So as we know, the hamstrings are hip extensors, so they have you extend the hip, they help you extend the hip, and they are knee flexors. So what we're going to do here is an easy isometric exercise to engage your hamstrings, is putting the leg into flexion, right? And we can do a manual, so that's an easy exercise that allows them to strengthen. We can do a manual resistant exercise where someone either applies if you have someone at home, applies the pressure towards knee extension, and the patient basically pulls into knee flexion. So he's doing an isometric contraction. So ready? So I'm going to pull you this way, you go that way, okay? Ready, set, go. All right, good. So we're going to hold that for a few seconds, or maybe even 5 to 10 seconds, and you keep on doing them. So you do, since they're easy strengthening exercises, you're going to do high reps. So you could do it like 15 times, and you can do 15 to 20 times, and you can do 2 sets, 3 sets. It's just an easy exercise that is appropriate for the second phase. And then you can progress those. If you want to engage more, you can progress to an active range of motion, which our original exercise was going to be hip flexion. Not hip flexion, 4-way hip, which allows the patient to get that range of motion in, because you're doing hip flexion, abduction, adduction, and extension, which is going to be our main exercise. So we're gonna focus on hip extension while laying prone, because his hamstring is injured. This is going to use his glutes, his hamstring, and maybe you may even feel it in the extensors for the spinal extensors. So what I'm going to instruct the patient to do is, he's laying flat on his stomach, so prone. He's going to lift his whole leg, so at the hip, he's going to lift his whole leg into hip extension. Good. Now bring it down after holding it for a few seconds. So what we want to make sure he's not doing is arching at the back, rotating his hips, or rotating the trunk. We want to make sure that we give him some cues. So if he's hiking at the hip too much, maybe just push your fingers down into that spot that he's hiking up, because the goal isn't to go as far as you can. The goal is to lift it to where he's not where he's engaging his hamstrings but not substituting any other movements. And then if you wanted to progress and you had the material at home, you can add a weight to the leg. Or you can progress by, EJ, stand up. You can progress by having a bench, a long bench that the person can lay flat on. So lay your head that way. Oh wait, this is the right leg? Oh, yeah, lay your head that way. On your stomach. So he's going to be laying prone on his stomach, and he's going to have his right leg, his involved leg, off to the side. So it's going to be off, hanging off to the side. And this is a progression. So you may do this in the early resistive phase, but I'm going to show you the progression to this exercise. So he's going to be laying on a bench, and then what he's going to do is he's going to do the same thing. He's going to lift his leg into extension. Straight, make sure your leg is straight. Perfect. And then he's going to let it go down. So the reason why that is a progression to the exercise that we just did is because it gives him a longer arc of range of motion. So his hip right now is in slight flexion, whereas when he was on the ground, it was already in a neutral position, going into hip extension. Now, on a higher surface, he's going from hip flexion to hip extension, which is a longer arc of motion. So now moving on, we're going to have our patient do an exercise for phase 3. In order to move on to phase 3, we know that we have to maintain the parameters that we restored before, which is minimize swelling, minimize pain, restore his full flexibility and range of motion, and make sure that he is still strengthening in those his fiber plug turned into type 3 collagen, so that he has more tensile strength. So our exercises for this phase is going to be, my patient is going to lay supine on, if you guys have a yoga mat, that's perfectly fine. If you have a carpet, that's perfectly fine. So he's going to lay supine on his back on the yoga mat. His head is going to be this way. So our exercise that is going to be appropriate for this section is going to be a bridge with the glute squeeze. The reason why we're doing this exercise is because our purpose for this our goal for this whole phase is to strengthen, increase strength in the muscle groups, and then also work on proprioception skills. So we're going to have the patient with both knees and hips flexed at 90 degrees with his feet flat on the ground. We're going to give the patient a little pillow to put in between his knees. We're going to instruct the patient to lift his hips upwards so that both his knees and his hips and his back are in a straight alignment. So lift at the hips. We're going to tell the patient to squeeze at the knees so that his glutes are engaged. Hold for a few seconds and slowly go down. Perfect. So in this position, we want to make sure that he's engaging his glutes, his hamstrings, his spinal extensors, and we want to make sure that he is not dropping at the hip. If he drops at the hip, that means he's going to be in hip flexion, and we want him to be in hip extension so that he can remain engaged with all his extensors, hip extensors, and his back extensors. This can be progressed by having a one leg support. So basically what I mean by one leg support is that our patient, back up just a little bit, EJ. Our patient is going to have one leg, both legs are going to be fully flexed at the knee and the hip at 90 degrees with the feet on the ground. One leg is going to remain fully flexed. So EJ is gonna lift his, again, he's gonna lift his hips up so that his back, his knees, and his hips are aligned and straight. Go ahead. Systematically, or at the same time, he's going to lift the injured leg straight. So straighten out your knee. Okay, just straighten out this knee so they can see. So he's gonna maintain that hold for a few seconds. Then he's gonna flex again at the knee and then drop the hips. Again, we want to make sure that the patient is strong enough. So he needs to be squeezing his glutes. He needs to make sure that he is engaging his hamstrings and that he is not dropping at the hip. We want to avoid that hip flexion and drop at the hip. It will later on hurt his back if he is not maintaining that. So that's one exercise, and that's an early resistive exercise. If he wants another exercise, the second exercise is going to be an RDL. So what we're going to have him do is we're going to have the patient stand up. If you have cans at home or plastic cups or anything basically that you can stack, you can use those. So you're going to be standing up. You're going to be facing me. So face me. Or actually, let's switch sides so the camera can get you. I don't know. Okay, so what is going to happen is that we're going to have the patient hold some cans. Or actually, first let me show you the movement. So stand away from the wall. So basically, an RDL is a single leg RDL. Is the patient is going to have his uninvolved leg in hip extension and his involved leg standing on the ground. So that's gonna be the base of support. So, which one is your uninvolved leg? Okay. So basically, the patient is going to stand straight, shoulder width apart. He's going to bend he's going to do hip flexion. So he's going to bend at the hips while at the same time extending his uninvolved leg into hip extension. So the first progression is going to be without anything, so without no weight, no stacking, nothing. We're just trying to work on his balance, and we're trying to engage his whole backside of extensors. So he's going to feel it in his hamstring. He may feel a little bit of a stretch. So you know how to do an RDL, right? We're going to have you like this, and we're going to have you flex at the hip, and then we're going to also have you extend that uninvolved leg. So go ahead. Perfect. And then once he gets parallel to the ground, and then his other leg is in hip extension, he can come back up slowly. Here we're looking for several things. We do not want his hips to be out of alignment. So if he's tilting one way, you need to tell him that he needs to maintain his pelvic neutral. We do not want him to, so things that you watch for are him being unbalanced, him being out of alignment, him bending at the trunk, he might start to bend at the trunk and do back flexion instead of bending at the hips. So those are things that you want to make sure you avoid. We don't want him, especially when you're using weight, we don't want him to hurt his back. So in order to progress, we're going to have him stack 3 of these. Now I say 3 of these because he's not going to be holding. It's harder to hold a whole bunch of cans than it is cups, but plastic cups would be way better for this, so he can make a bigger stack. But in order for us to show you, he's going to be holding 3 of these. He's going to do that same exercise, and he's going to stack a 3-can pyramid. So again, I'll do it with you. We're going to have the involved leg standing. We're going to have the uninvolved leg and hip flexion. And then we're going to flex at the hip, extend, extend, come back up. We're in hip flexion with the uninvolved leg. We're going to extend at the hip with the uninvolved leg. We're going to put that down. We're going to return to neutral position. And then we're going to do it one more time. We're going to flex at the hip, not the trunk. Extend on this uninvolved leg and come back. And that is one progression. Another progression. If you have free weights or dumbbells at home, that's perfect for this exercise. You can have a 5 pound, a 10 pound, a 15 pound, whatever pound that you're comfortable with. You can hold in your hand and execute the same exercise. And this is us progressing in his rehab, because he should already have his type 1 collagen should already be giving him enough tensile strength to protect him during these exercises. All right. So he's going to remember to have him stay neutral. Don't start unless you're neutral. Back should be straight. When he flexes at the hip, you can keep that. Flex at the hip. Make sure his back is straight, parallel to the ground, and his other leg is in hip extension. Come back up. Perfect. Bring that leg back up. And then you can have them do, for these exercises, the easier exercises, make sure the reps are high and the sets are low. For this exercise with the weighted, with the weight, you can make sure that to promote strength, you can make sure that the reps are kind of low and the sets are high. So he could do 3 to 4 sets of that, and then low reps, so 8 to 12. All right, so now we're gonna move on to the phase 4. I'm just gonna tell you up here, in order to move on to phase 4, he needs to improve his proprioception, his strength. He needs to be ready to execute functional exercises and sport-specific exercises. We need to maintain the parameters of the past phases. He shouldn't have any swelling. He should definitely not have any pain. He should have his full range of motion, no excuses, and he should be able to stretch. Basically, he should already almost be healed and return to play when moving to phase 4. We're going to go downstairs because we have some functional exercises that we want to show you.